I am Dr.C.Rex, Chief Orthopedic Surgeon from Rex Ortho Hospital, Coimbatore. I am just going to say a few words about the prevailing situation in COVID-19 and also the health system in India. Nowadays, you see a lot of COVID-19 patients coming up to the hospital, and always there is a apprehension among the public as well as among the doctors how to manage or handle the situation. And people are more than the disease, people are afraid of the money which they need to spend to take care of themselves. And here I want to point out few things. Always prevention is better than cure, that we all know. We always insist on social distancing, proper face mask and face shield protection, and also proper sanitation. And in spite of all these things, sometimes you get contact and you get prone for infection. And this infection is many times is curable, but always you see 1 to 2% of times it can be life endangering as well. So when you caught into this situation, always we doctors advise to have a good healthy diet and do some proper exercises, get some medical management team to get involved in the treatment at the early phase, rather than leave it to late presentation and come into problems of any breathing difficulty and diarrhea and all sorts of things. And see, many times what I see in our practice, there is always a question about the money which is involved in treating these patients. We as a frontliners in managing these patients, we always take utmost precaution that we do not cross-infect one patient to another patient. So for that, obviously we need to have the proper protection equipment system, so that is a PPE. And PPE, there are various types of PPE in the market. Many times people are not aware of, and you have PPE varying from 200, the cheapest, and a very high quality up to 3000 as well. I'm talking about in rupees. So there are various types of qualities, and some are reusable and some are used exclusively in operation theaters, so that there is no contamination, or the spillage which you get from patient to patient also is not cross transfer to another patient. So the quality of PPE is also very much important. And when we talk about PPE, as a layman, they know it's just only the surgical gown which covers themselves. It is more than that. I would say that you need to have a proper hood and also a proper venting system, and you should have a face shield, and you need to use the N95 mask, and you should have a proper boot to cover yourself, and then a proper way of disposing things also matters once it is used, and never it is reusable. So you have different types of PPEs in the market, and if some of the best qualities are sometimes imported, and it may be expensive as well. So as a public, they should not. The media always tries to focus or tells the bad things about the hospital management, which I feel is totally wrong. We always feel that we empathize the patient, we give maximum benefit and cost-effective treatment for the patient, and never, I would say not never, maybe 1 or 2% of the times, sometimes there can be mishandling. But that always happens in any field, not only in medical field. Always 1 to 2% of times odd things happen everywhere in the world. But always these odd things are spoken more than the good things that is happening for the patient or to the society. And this everybody should understand. And we always treat from the heart and soul, and we endanger our life to treat these patients. But we never worry about our life when it comes to treatment, because it is the ethics in the medical ethics that we always treat them professionally rather than treat for the sake of treatment. and nobody runs back or says, no, I will not treat the patient because you have COVID. That is totally wrong and unethical. And we put all the efforts, and we take care of the patients to reach their optimum good health, and we risk their life, and we take all the precautions in the form of PPEs and all the sterile environments which we need to manage at hospital. One thing which I want to point out to the patient, they look at only the cost of the medicines which incurred to treat them, or the room which they stay, or maybe the disposables which are used for the patient. But more than that, there are a lot of overhead costs for the hospital, like taking care of their doctors and staff. They work for 1 week, and 1 week they go for quarantine, and so they are all paid during the period of quarantine as well. So that is a hidden cost which many patients, they don't understand. And the other thing is, once you are dedicated to COVID hospital, the whole environment need to be taken care of, not just your room or the stay, the corridor which you are staying. So everything need to be well protected and disinfected, and should be regularly maintained. Maybe twice or thrice a day it must be disinfected, and nobody should get caught with a COVID infection from a hospital environment. And so utmost attention is done for a clean environment, clean air system. So a lot of cost is incurred by getting this into action. Other than that, if you have a COVID hospital, and the normal inflow of other patients, they don't come at all, and so naturally the revenue generated by the hospital is stopped. And if you have a separate ventilator, an ICU or an ambulance, and that cannot be reused for any other patients during the time, so it is all designated for one purpose, and that always adds up to the cost. And see, these things the patients must understand, and this must be this is subdivided, and the healthcare management system adds up all this in their bill. So maybe there's a misconception that doctors are overcharging the patient, but I think that is 98% of times I would say it is wrong, and it is for the benefit of the society and for the patient. And also, to run a hospital, these things are mandatory. So we always do give the best care with the cost-effective management, and definitely the patients are not overcharged at all. And always the government has given a norms of how much to charge for each patient, the minimum at least, and I think everybody will stick on to that. And if anything untowards or unexpected cost has come to the patient, definitely they can question a doctor or the hospital to find out what exactly or what brought up the cost. So there must be openness in everything, and patients also and the doctors also must feel comfortable treating a patient, and there should not be any misunderstanding between both the parties. That is very important. And I feel at this particular time of COVID-19, more than the cost or it is a social responsibility of every doctor to make sure that they give the best of everything with the available resources what they have in the hospital at the cost effective manner, and even from the poorest of poor to richest of rich, they get the same treatment without any negligence. And this can be done effectively if there is a standardized way of management, and this can be done only if everybody understands and cooperates and do a effective management of the whole society. So that is what I want to let the public know. Thank you very much.